Exjade is a medication that helps to reduce high levels of iron in the body. It is used for people who have received multiple blood transfusions or have a certain blood disorder that causes high iron levels. This medication works by binding to the extra iron in the body and allowing it to be passed out in the stool. This helps to prevent problems such as heart failure, liver disease, and diabetes that can occur when the body holds on to too much iron. Exjade belongs to a class of drugs known as iron-chelating agents, and it is important for people with certain blood diseases to manage their iron levels to stay healthy. Before you start taking Exjade, make sure to read the medication guide provided by your pharmacist. You should stir the tablets into water, orange juice, or apple juice until the tablets have completely broken apart and are well mixed into the liquid. Take this medication by mouth on an empty stomach at least 30 minutes before food as directed by your doctor, usually once daily. Do not chew the tablets or swallow them whole. Always mix this medication into liquid as directed. Use this medication regularly to get the most benefit from it. To help you remember, take it at the same time each day. Do not increase your dose or use this drug more often or for longer than prescribed. Your condition will not improve any faster, and your risk of side effects will increase. The dosage is based on your medical condition, weight, lab tests, and response to treatment. Your dosage may need to be lowered or your treatment may need to be stopped if you get certain side effects. Follow your doctor's instructions carefully. Also, avoid taking this medication with antacids that contain aluminum, as they can bind with Exjade and affect how it works. Some common side effects of Exjade may include nausea, vomiting, diarrhea, or dizziness. If any of these effects persist or worsen, it's important to notify your doctor or pharmacist. Remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the risks. Many people using this medication do not experience serious side effects. It's important to tell your doctor right away if you experience any serious side effects, such as hearing loss or vision changes. Exjade may also decrease bone marrow function, which can lead to a low number of blood cells. This can worsen anemia, decrease your body's ability to fight infection, or cause easy bruising or bleeding. If you develop symptoms such as unusual tiredness, pale skin, or signs of infection, it's important to contact your doctor. This medication may rarely cause serious stomach or intestinal problems, such as bleeding and ulcers. If you experience symptoms such as stomach or abdominal pain, black or bloody stools, or vomit that looks like coffee grounds, stop taking Exjade and consult your doctor. Exjade can also rarely cause serious liver or kidney problems. Symptoms of liver damage may include nausea, vomiting, loss of appetite, abdominal pain, yellowing of the eyes or skin, and dark urine. If you develop signs of kidney problems, such as a change in the amount of urine or frothy urine, it's important to notify your doctor. While Exjade can commonly cause a rash that is usually not serious, it's important to seek medical help right away if you develop any rash. In addition, if you notice any symptoms of a serious allergic reaction, such as rash, itching, swelling, severe dizziness, or trouble breathing, seek medical help immediately. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects not listed above. If you experience any side effects, it's important to seek medical advice and report them to your healthcare provider. Serious kidney disease, liver disease, and stomach/intestinal bleeding may rarely occur while taking Exjade. These conditions are more likely to occur in people with pre-existing kidney or liver problems, as well as in older adults and those with serious blood diseases. It's important to keep all regular medical and lab appointments while taking this medication. Make sure to consult your doctor for more details. Before taking Exjade, make sure to inform your doctor or pharmacist if you have any allergies or if you are allergic to it. This medication may contain inactive ingredients that can cause allergic reactions or other issues. Also, let your doctor or pharmacist know about your medical history, especially if you have kidney disease, liver disease, low platelet counts, advanced cancer, or certain bone marrow disorders. Exjade may cause dizziness or blurred vision. Avoid alcohol or marijuana as they can make these effects worse. Do not drive or use machinery until you can do so safely. Limit alcoholic beverages and talk to your doctor if you are using marijuana. Before undergoing surgery, inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you develop any illness that may cause dehydration, such as fever, diarrhea, or vomiting, or if you are unable to drink fluids, notify your doctor right away. This is especially important for children, as the doctor may need to stop or adjust the treatment. Children and older adults may be more sensitive to the side effects of Exjade, so it's essential to communicate any concerns with your doctor. If you are pregnant or planning to become pregnant, do not use Exjade, as it may harm an unborn baby. If you become pregnant while using this medication, talk to your doctor immediately about the risks and benefits. It is uncertain whether Exjade passes into breast milk, so consult your doctor before breastfeeding while using this medication. It's important to be aware of potential drug interactions with Exjade. Make sure to keep a list of all the products you use, both prescription and over-the-counter, and share it with your doctor and pharmacist. Do not change the dosage of any medicines without your doctor's approval. Some products that may interact with Exjade include fezolinetant and other drugs that can cause bleeding/bruising, such as antiplatelet drugs and NSAIDs. Aspirin can also increase the risk of bleeding when used with Exjade, but if your doctor has directed you to take low-dose aspirin for heart attack or stroke prevention, you should continue taking it unless instructed otherwise. Exjade may also decrease the effectiveness of hormonal birth control, such as pills, patch, or ring, potentially leading to pregnancy. It's important to discuss with your doctor or pharmacist if you should use reliable backup birth control methods while using this medication. Additionally, be sure to inform your doctor if you experience any new spotting or breakthrough bleeding while on Exjade, as these may be signs that your birth control is not working effectively. If someone takes too much Exjade and has severe symptoms like fainting or difficulty breathing, it's important to call for emergency help right away. In the U.S., you can call the local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. It's important not to share Exjade with others. Before starting and during the time you are taking this medication, make sure to have lab and medical tests done. These tests may include checking your serum ferritin, blood counts, urine, liver and kidney function, vision and hearing, and liver iron concentration. It's important to keep all your medical and lab appointments and consult your doctor for more details. If you forget to take a dose, take it when you remember. But if it's almost time for your next dose, just skip the missed dose and take your next one at the usual time. Don't take extra to make up for the missed dose. Keep Exjade at room temperature and away from light and moisture. Don't store it in the bathroom, and make sure to keep it out of reach of children and pets. Don't flush Exjade down the toilet or pour it into a drain unless you're told to do so. Make sure to properly dispose of the medication when it's expired or no longer needed. You can ask your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.